And because I was distracted with these two very, completely separate processes that were nothing to do with COVID, I kind of was so absorbed and so time poor and stressed. I didn't do my due diligence on the jab.
Dr. Lee Willoughby was a seasoned anaesthetist and functional medicine doctor at the onset of the COVID era in 2020. In this interview, Lee is refreshingly candid as she reveals how she was initially duped by the fear campaigns and how she later woke up. She discusses being let down by her own colleagues following her vaccine injury and how the Medical Council of New Zealand threatened prosecution after she spoke out. Thankfully, like an increasing number of us, she has found a better way forward outside of the medical system. Thank you, Lee, so much for joining me tonight. It's a real pleasure to have you. Thank you.
You're very welcome. It's a bit of an honour to be interviewed by you anyway. So thanks very much for having me.
So, Lee, for people that aren't familiar with you and your background, would you be able to just start from the very beginning about where you were trained and your education and that?
I grew up with my mum was a journalist and my father was a photographer, a press photographer. And then he became, he went into his own business and was very successful. So I came from no medical background, but by the time I was 11, I really wanted to be a doctor. I sort of was kind of single-minded really and ended up going to medical school in 1991. And I spent 5 years at Manchester University doing medicine. I was always hell-bent on it really. I had a fascination for the human body, and I had been brought up with a desire for one reason or another to really stave off the ills of the world, I guess. I graduated in 1996. I did medicine for a year and was going to go down that path, got my first part of my MRCP. There was just something in me that said, if I just go down the physician route, and don't do anything else in medicine, then I possibly might not be the well-rounded doctor that I wanted to be. So I started looking at what else I could do. So I did some emergency medicine for 6 months. I thought, well, what else do I need to know? Where else scares me? And I thought, well, the black hole for me was intensive care. And it was full of machines and scary stuff. And I had no clue about it. And I realized that the person that comes to rescue you in the middle of a terrible situation is an anaesthetist. And so I ended up on ICU for 6 months, but took me 3 weeks to decide that was what I wanted to do. I ended up doing anesthesia training, which takes 7 years in the UK. After I'd done my first 2 years, me and my husband, we got married in 2000, and my husband's from Hawke's Bay. We ended up taking 6 months out and going traveling. And interestingly, we ended up in New Zealand, of course, for a couple of months. I got interested in nutrition because his mum was taking these products, and we poo-pooed her and said, no, that's ridiculous. You're just spending money for no reason. Just really ignorant comments. Anyway, she just turned to me and said, oh, if I didn't take these, Lee, I wouldn't have a business. I just wouldn't be able to work the hours that I do. And she was a commercial cleaner. She's not someone to exaggerate. So I just took her seriously. And then when I got back, she sent us some information about the stuff she was taking. And then it just took me into a headlong snowball effect where I just could not get enough of books and literature on nutrition and how it affects the pathways in the body and how it can modulate inflammation. As a result of that, I decided I wanted to do some research. I went back to my training after 2 full-time years doing research and became a consultant at Salford Royal. I spent 8 years there as a consultant, and me and Harvey, we decided that we would move here. So I started looking for jobs, and I got a full-time job in Gisborne. So we moved here in 2016. It was wonderful when we first got here. We had lots of cups of coffee, and we just sort of sat back and just relaxed for a wee while.
Going forward then, so it sounded like it was a bit of a honeymoon period when you first arrived in Gisborne, things going well. What happened after that for you with your work in Gisborne?
The 6 years that I spent working at Gisborne Hospital, I absolutely adored the clinical work. I've seen the most impoverished, thoroughly salt of the earth people come in with the most devastating injuries or illnesses. And the breadth of practice is just huge. I mean, you never know what you're going to get. And you really get to know the team around you. And that was something that was really rewarding, just working that closely with people to get the best outcome for people. Yeah.
I wanted to ask you, did you have any sense of disillusionment about the medical system, or you felt very that it was right and that things were good, I guess?
Well, that's a really good question. Obviously, with my nutrition interest, I kind of trained in two different streams, if you like. So I did all my anesthesia training and got to where I was, and I was working, but I was also in nutritional medicine and stuff. So I already had a very different lens on the human body by that point, because I was always thinking to myself, well, what's the reason for this? Why has this person got this? I was already thinking along the lines that medicine was on the wrong path. You know, that medicine was very is the ambulance at the bottom of the cliff. There was nothing preventive about it. It's couched in terms of prevention, but in my view, you know, immunizations and screening is not preventive medicine. Yeah, when the pandemic came, I fell for the fear, unfortunately, eventually, that we were so pent up. And I was the one that really got sucked in with the, you know, like, how do we prepare people and how do we prevent people from getting sick? I was playing well, what if this happens? What if this happens? What if we can't support people's kidneys? And now I look, you know, well, I know why the kidneys were failing, but you know, in those places where they had that problem. But yeah, I was trying to prepare a very, very antiquated infrastructure for something that was being purported to be Armageddon. Yeah, I got heavily sucked in. I now look back on it and think that was just laughable, but at the time I really thought that I had to protect people. And because I was distracted with these two very, you know, completely separate processes that were nothing to do with COVID, I kind of was so absorbed and so time poor and stressed. I didn't do my due diligence on the jab, and I ended up I waited and waited before I had the COVID injection. I knew there was something not quite right about it, and my colleague, who subsequently ended up being mandated out of my department in November, he had read the literature, and he kept telling me that I ought not to get it. And now I really regret obviously not listening to him. But I was just so, and I was in a rabbit in the headlights. I was dealing with these two other problems, and I just dropped the ball, I guess, as far as my own health is concerned. And none of my colleagues had any kind of or ill effects from the injections. And of course, the culture within healthcare, even before it escalated into the way it was towards the end of 2021, the culture is very much you just, you toe the line, you do what's right for patients, and so you do your duty kind of thing. The problem with that is that everyone believes that vaccines are entirely safe. Vaccines were not my area of expertise and never have been. Fortunately, I can hand on heart say I've never been involved in giving them. So that was something that I was incredibly grateful for. I ended up having the first jab. They came out around just the beginning of April, I think, in 2021. And then I ended up waiting until June before I had mine. They actually had stopped giving it at the hospital for staff by that point. I actually had to go and get it in town, which is just so ridiculous. There's a few people that got a really sore arm, and I got a really sore arm on the first jab. And then I had them 3 weeks apart, and I was training for a 5-kilometer run, which I was just trying to break back into doing some regular exercise. It was in the 5th week that I had my event. So after a long day's work working with a trainee, well, I hadn't eaten anything at lunchtime. I found the fridge empty and went off to the supermarket. When I got back, I had abdominal pain. And I ended up, that escalated over the next 3 or 4 hours. I ended up in the emergency room with no blood pressure, the most unconscionable level of pain that I've ever experienced. I was desperate for some pain relief, and they wouldn't give me pain relief initially because I didn't have a blood pressure. Fortunately, my colleague who was on call, who was obviously one of my department, came along and took the plunge and gave me a large dose of something strong so that I could have the scan. But no one really knew what was going on, what was wrong with me, and I didn't. And I, quite honestly, if someone had come and offered me a lethal injection, I would have took it, because it was really that bad. And I wouldn't be that lightly, because I've got my 2 girls, I've got Harvey, and I would never, ever have left it, willingly. But it was a bit like being, how I'd imagine being eviscerated, I ended up having a scan, and about an hour later, the result came back. But what was really fortunate about that night was, because there was no one on call, my scan was sent to a vascular radiologist, who immediately said what the problem was. And I had clotted off my superior mesenteric vein, which is the vein that drains the entire small intestine and most of the colon as well. My surgical colleague, came running in and go, "Lee, I know why you're in so much pain now." And he said, "You've got this." And I was like, okay. I wasn't really talking, but I knew what that meant. So I made them give the bolus of the blood filling treatment in ED rather than waiting. So I got to ICU. At the time, obviously, I didn't really think about why that had happened to me. It was only when the pain dissipated, sort of in the early hours of the morning following, that I kind of computed. I was starting to think, what the heck? Why would I have this? What on earth would trigger something like that? And I've been in medicine, as I said, since 1996. I have never seen anyone with a superior mesenteric vein thrombosis. It's a bit like myocarditis. That's something that people really need to understand, is that myocarditis is extremely rare. And I have only ever seen one case of myocarditis. That was early on in my training. But that's the only time, and I've done intensive care in many different hospitals over many, many years. And that's the only case of proper myocarditis that I have seen. So the fact that people are suffering from myocarditis hand over fist at the moment is highly unusual and should not be played down. And the consequences of it are devastating. So superior mesenteric vein, like what? So I went and looked at the literature later down the track, and found that really the only people that get that are people with chronic pancreatitis, or maybe if they've had recurrent perforations in their abdomen, they've got lots of fistulae and, you know, inflammation in the retroperitoneum. And so none of those applied to me. And I don't have a family history of anything, never had a clot myself, never, you know, I've been on long haul flights, never had a clot, been on the oral contraceptive pill, never had a clot. And now I've had loads of tests to show that I don't have any clotting tendency. I've even been tested for the JAK2 mutation. And there's a couple more that I want to do, which are really rarest hen's teeth type tests.
And it was the perfect storm for you then, Lee, in terms of the lead up to this, to deciding to have vaccine, you know, the vaccines. You had been somewhat hesitant about it. There was other things going on that were sort of outside of your control. You're in quite a stressful position job that you're running a lot of things, and this happened, and then you're on the other side of the fence, and probably felt quite helpless at that time.
I think the hardest thing for me was what happened in relation to my so-called diagnosis. I relatively rapidly got better from the pain perspective. So I woke up, I think it was about 3 o'clock in the morning, and woke to realize that the pain was so much better. And so I started to feel a bit relieved that, you know, that wasn't going to be the end of me, kind of thing. But then I got a visit from the surgical team. My colleague and his group told me that I was going to be taken off my heparin infusion in the morning because the vascular surgical team at Hamilton had basically decided that I hadn't had what they'd said I'd had. So they told me that the scan had been interpreted wrong and that they were going to send me for a Doppler ultrasound the next day. And so that's what happened in the morning. They stopped my heparin and they sent me down to the radiology suite. And they did a Doppler ultrasound and declared that all my vessels were completely normal and there was no clots. And then they sent me home with no ongoing anticoagulation or any plan apart from having the clotting tendency blood tests the following day. The day they discharged me was just after the lockdown was announced. I wasn't necessarily that keen about staying in the hospital because I knew if I stayed, I wouldn't see anyone, that they would just stop everyone visiting. And I didn't want that. So, and I thought, well, if you're not going to do anything about this, then I may as well go home. So I did have those blood tests, but I went home in a state of quandary because it was like they said that whatever happened that night, it was a lie, that it didn't happen, and that it must have just been something and nothing. I had my, you know, sort of later down the track, I had, you know, my colleague who was in my department who's steadfastly pro-vaccine, telling me that I was 1 in a million and there was no way that it was anything to do with the vaccine and all of that stuff. I mean, it took me 2.5 months to recover from it because, as you all know, it wasn't just my gut that got it. My whole nervous system was totally shot because the damage to my gut had an effect on my vagus nerve. But because my gut was injured and 90% of the vagus nerve is messages going upwards, my vagus nerve took a real hit. And that meant that my rest and digest part of my nervous system was literally not working. And so I felt incredibly anxious and in fight or flight for a very long time after this happened. And it took me a long time to just get over that, for things to start to settle down. I went to my GP and I said, look, they told me this is what the diagnosis is. I've seen the report. I think I should be on, at the very least, I should be on aspirin. So she prescribed aspirin for me and was perfectly happy to do that. But that was all self-instigated. And I did that for 3 months solid, ramped up my education because I just went into the rabbit hole of what the jab is and why it might have caused my problem. That's when I so-called woke up, when I realized what the nature of the concoction is. If you could devise something that was designed to harm human beings, this is it.
It's an incredible thing that happened to you though, Lee, and it must have been a brutal wake up. What happened, so with something, with an injury like that, it must have affected your gut, did it? In terms of bowel habit and things like that?
I couldn't eat properly for 2 weeks, and I kind of realized that I would struggle to digest initially. But I got a sense, I just basically would only introduce small amount of food just to try it out to see if it would be all right if I ate it. My whole digestive system was just in shock. You know, it was in like a stunned mode. I think the thing that outlasted that much more is what I've said, which is the total anxiety and feeling of catastrophe and doom, things that you would normally rationalize easily and dismiss straight away became problems. And that was the reason I didn't go back to work for 2.5 months, because in my job, you absolutely have to be on your A game, and it's an extremely stressful job. I went back, and after a week, I resigned from everything. A few things had happened in my absence that made me realize that I was just a number. And they probably breathed a sigh of relief when I did resign, because I'm straight-laced. I want the truth. I won't tolerate poor behavior or I won't tolerate poor practice.
What did they say to you that happened then? What was the diagnosis that they gave you?
They didn't say anything. I never had any follow-up. I reported my own injury to CALM. I reported it as an individual that had the incident, and I also reported it. I made them really aware that I was reporting it on the basis that I was a medical professional. I heard nothing, absolutely nothing. Never heard anything from CALM whatsoever. The only reason that I have had a response from them, which was at the end of last year, because Alison Goodwin, she helped me get some kind of response from CALM, because they're supposed to investigate all of the serious events. What it demonstrated was that they had colluded with the clinicians that were involved in the judgments made about, one, whether the actual diagnosis was correct on the scan, and two, did I have anything clinically significant happen that night? And they decided no to both of those questions. They were trying to fob me off with all sorts of other reasons, or trying to deny what it was. But what's happened recently is that in October last year, I had a recurrence of my thrombosis. The same thing happened to me second time over. And it's happened in exactly the same place. So 3 years down the track. And now they've had to admit that I have a persistent superior mesenteric vein thrombosis. Although it would have been great if I hadn't had that episode, what it has done is it has validated the fact that I had it the first time around. And now I have a number of specialists discussing my case.
So what happened? So did you have another admission with severe abdominal pain? Did the same thing play out again?
Yeah. And I knew what it was this time, because there's no way you forget that kind of pain. It was actually not quite as bad this time in terms of the level. I still vomited at Manatee on the way to the hospital. I still required heavy duty painkillers So yeah, I was in for a bit longer, and yes, I was put on some treatment this time. And I met the surgeon who had discharged me with no treatment or follow-up again. And he was there on the ward round in the morning, and I made it very clear that it was very good that they were actually considering treating me this time.
One blessing that I see from it is that your experience will resonate with so many others that have been gaslit by the system, who have had injuries, and can will see that it's not, because I think that's the worst part of it all, is when you're told that this is in your head and this is not happening to you. It's probably one of the worst things anyone can experience.
Yeah, they that was the reason I did the interview on RCR, was because I've seen it all. Obviously, everyone's seen it play out. I've seen people incapacitated. I've seen people die of turbo cancer. I've seen people with multiple relatives just drop dead within a short space of time. I know one person whose both his parents died within a few weeks of each other, immediately after they had the injection. I have seen the division that has deliberately been orchestrated, this division between all manner of groups. One of the things about this is that it's just, and I'm sure you'll have thought this, but it literally has permeated every layer of society, every industry, whatever seniority you are, whatever your family context, it's just pulled everything apart. It's just utterly shattered trust and social cohesion, social connection. It's targeted rejection. I spoke about this last year. Targeted rejection is one of the most biologically damaging processes that can happen to an individual, and it's worse than social isolation. If you're deliberately excluded because of something that you believe is right or whatever. And I've seen that in Spain. And so I did the RCR interview because I wanted them to know that there was a medical person out there who was just like them, who got hoodwinked, who got drawn into it, who made the mistakes, just had the consequences. I just can't not speak out about it. It's what I was meant to do. It's what we are supposed to do as doctors. We're the whistleblowers. We're the gatekeepers. We're the safety net. We're the people that should be there to stop catastrophes.
I think it is an incredibly courageous thing that you've done, Lee, and I really admire you for doing it, because I know of another person, another doctor in New Zealand, who early on had a stroke, because doctors were the first to have, as you know, all the health practitioners were the first to get the jab, because it preferentially went to them first to protect them. And this person had a significant stroke in their 30s after, I think it was 12 or 24 hours after the first jab. And they didn't speak out because they were the primary breadwinner for their family, and they were strong-armed by the medical council not to. So it's just, you realize it takes such courage to do that. And just for people that don't know, that it's the Reality Check Radio, which is a fantastic organisation that interviewed you. But what happened after that, Lee? Because your story gets even more crazy after the interview.
Well, just to sort of back up a little bit, in 2022 they mandated the booster. And so when I'd resigned from Gisborne, I decided to just do locums now and again, and I wasn't really prepared to travel like far and wide, but I would go to relatively local regional centres to do locums and really enjoyed them. When I was at Rotorua, they mandated the booster the following week. And I'll just tell you about this because it's just so remarkable. I mean, they're a lovely department there, and they really were keen for me to go back. And the secretary in the department said, "Oh, why don't you come and work here, Lee?" Or I said, "Well, I'll come and do locums for sure." And I said, "But actually, from next week, I won't be able to come back." And she said, "Well, why not?" And I said, "Well, they're going to mandate the booster next week." And I said, "And I will not have it under any circumstances because the second one nearly killed me." And he just said to me, "Well, oh, well, why don't you have it in ICU?" And I just looked at her and I was very restrained. Yeah, I felt like tearing a strip off her, to be honest. But I just said, "Look, I am not prepared to die for my profession." And their head of department was in the room, and he actually tried to wangle me to, actually to try to get a dispensation for me to go and work there without the booster, and they refused. And so that was the end of my so-called anesthesia career at that stage. And so I then obviously fell into my clinic full time. And I mean, it's always what I would have ended up doing once I got a bit too decrepit to do anesthesia. And I absolutely love it. And it's a very peaceful and beautiful place to work. So when the jab was rolled out, the medical council wrote to every single doctor in the country and said, "We expect you to promote the vaccine. There's to be no anti-vaccination messages. That's inappropriate." So that was kind of a big, oh, by the way, you can't speak ill of the vaccine. And because I didn't speak out straight away because I was conscious that if I did that, I would jeopardize not only my anesthesia career, but my clinic. And I was really I was fearful like most other people, really. What I did was, instead of like shouting it from the rooftops, I would have a little party if they hadn't had the jab, and I still do that. I still like whoop and and high five, and also when I do meet people who haven't had it, and I think there's a few more than we think, but equally I just tell people not to have any more, and speak, and if they want to know more, I will go into some detail about why they shouldn't have another one. And then I decided, when the medical council revoked this statement that they had, and they quietly did it, they never announced it to any of us, that no longer stood, that sort of thou shalt not speak ill of the vaccine. So I thought, stuff that, I'm going to speak out now. That hence my RCR interview. Anyway, that was in the November, and then there was this long summer holiday. I'm sure the medical council were dining out and going on exotic holidays, and yeah, I'm sure that would have been fantastic for them. And then on the 1st of March, so they really took a long holiday. On the 1st of March, I received a phone call and a letter attached to an email from the medical council telling me they were concerned about my comments on the RCR podcast in relation to my adherence to good medical practice, the guidance on social media and digital communications, and the guidance on unprofessional behaviour. And I thought, okay. So I speak out one time. I didn't even really go to town. So I wrote back to them and I said, please could you clarify what comments you're particularly concerned about? because I have reviewed these documents and there is nothing in these documents that relates to anything that I discussed with Peter Williams. Kind regards. And then when the report replied and said, you need a lawyer. Then I started to discuss, well, with some other people. And that's when I met you. And I am very, very, never underestimate how grateful I am for what you advised me to do. Because I'm very glad that I took that route. And so what I chose to do, in short, is I basically put the medical council in a position where they had to deregister me. So I gave up my license to avoid what would probably be a 3 or 4 or 5 year battle. And I'm slightly different to all the other doctors who are fighting the medical council at the moment, in that those might be the last years I have. And I'm not going to spend my last years fighting the medical.
I'm so thankful too, Lee, of the route that you decided to take. And what I wanted to know was what do you think about the indemnity lawyer setup with the medical council? Like how that process works?
Prior to them revoking their statement, which was obviously the trigger for me to feel like I should speak out, I was indemnified by the organization that indemnifies the vast majority of doctors. And before I went on RCR, I made a very deliberate move and I stopped my indemnity with them and exchanged to a new organization, NZMPS. And I did that because even if it got dirty, if things started to get bad, I would rather be indemnified by an organization that has been born out of this despicable kind of situation that we're now in, rather than be railroaded into what many of my colleagues have been experiencing. And my opinion, and this is my opinion, is that that organisation that indemnifies the vast majority of doctors is in the pocket of the medical council. I think there is a very unhealthy relationship between what goes on in the committee of the board of the medical council, and what goes on at the tribunal level. One of the reasons why I absolutely detested my indemnity insurer was because they deigned to do a webinar during the pandemic, which asked the question, do we as doctors have the right to refuse to see or treat patients who are unvaccinated? I actually went on that webinar because I was just so disgusted. I had to see for myself what they were saying. And I realized that they were not an organization of integrity.
Yeah, well, you can see for yourself, or people can see for themselves. One thing I thought was incredibly interesting was that you have lawyers, so you've got indemnity. Every doctor has to have indemnity in order to work. You can't work anywhere in New Zealand, and I assume that's overseas as well, unless you have indemnity. It's all staffed by lawyers. The medical council is now pretty much all staffed by lawyers. And then you've got disciplinary tribunal that is all lawyers, and they all know each other. They're all friends and things. It's so corrupt. It's not even, you can't go into that world.
Yeah, I was really stunned by your recent video and the whole thing about the guy that represented you earlier on, and now he's batting to the other side when actually he's not allowed to do that. The moral and ethical backbones that we thought were in these organizations, in my view, have been shown to have just been completely removed. I mean, there's no the judiciary, the crown entities, um, the DHBs, as they were called, the government organizations. There seems to be such an endemic level of lies and deception and self-serving. I mean, it all seems to be that the rewards are for those that are seeking status and money. It's all driven by ego.
Did you end up talking again to that person that tried to encourage you not to get the jab originally?
I'm not going to name him, but I am going to salute him for what he did, because what he did was he served this community for, I think it was 12 years. He was a dependable workhorse. He loved it here so much he hardly ever went on holiday. He was always the person that would support the service if there was a gap. And we became good friends, and especially his family and his wife and me were are good friends. And what happened was he was mandated, he sold his house that he had waited a long time to design and build. It had literally only been in the house maybe a couple of years. And they left the house with their children and went back to Europe. What is fantastic is they come back, but not they don't sort of live in this area. So, but we do quite frequently talk, and we exchange. Well, we talked when they were away as well, and they're that close to us that they would just come and stay. We'd go and have dinner with them, and it's that kind of thing.
What has been the biggest light bulbs or positive things that you feel has come out of this, Lee?
I'm not going to talk too much about it, but finding God was a really big deal for me. Having been a completely a-religious person, no faith whatsoever. So that's been a big journey. And I suppose it's made my marriage a heck of a lot stronger. And even though after they mandated the booster, and we had to sell our house because I couldn't sustain the mortgage anymore. So, I think my dad finally thought I'd made it, because I had a beautiful 4-bedroom home with a double garage with electric doors. And we had about a couple of acres of land, and we had a wool shed that was partially converted into sort of rudimentary sort of accommodation, and had a beautiful garden, and it was just 5 minutes drive away from everything that we needed to be next to, and we sold because we couldn't sustain the mortgage, and we bought a beautiful piece of land, and we don't have a house. And it's a very at times it's frustrating, don't get me wrong. There's been a lot of sacrifices. I jokingly said yesterday morning, I just can't wait for the day when I actually have a wardrobe again. Um, but but we currently live in a caravan that I purchased with some of the money that we got from the house. And we live on this beautiful piece of land, which I wouldn't swap for the world. And we really are like brass tacks. It's like really down to the basics. And we're self-sufficient pretty much, almost, not quite, but off grid, grow our own food, raise our own animals. We've always had chickens, but yeah, who knows what's going to happen about chickens, eh? Well, they'll have to kill me first to get to my chickens. That's all I can say. It's meant that I'm not doing on call anymore. And it took me about 2 years to fully realize what it's like now to have a normal day-night cycle. And I think because at Gisborne there's no trainees, and you're, as the anaesthetist on call, you're kind of the linchpin. And I don't mean that arrogantly. I just mean that because of the way that our job works, that because you are responsible to the theatre, and you're responsible to the intensive care unit, and you're responsible to the maternity unit, and you're responsible to the ED, that can make for a very, very long night. And so a 24-hour stint at Gisborne was getting more and more onerous, not less. There were a few times where I was literally out all day and all night without a break. Yeah, so having a day-night cycle's been a revelation, because I mean I've done that ever since. You'll have been saying it's like since I was 23, I have never had a normal week, except potentially when I went on holiday, but it's still not normal because you're still recovering. And I think that's one of the reasons why I'm still alive, is that yeah, if I was still doing, I'd just be dead now, I think, if I'd had to continue doing the work that I was doing to the degree that we were doing it. I just don't think I would have survived.
What do you do now? So for the audience, what are you up to now with your clinic?
So as I mentioned before, I did all my own kind of education with nutrition and stuff. I read lots of books. I started because I was at the university with my degree, my research degree. I had access to literally any literature that I wanted to read. So I was reading all the literature as well, and I was sort of going, well, why on earth did no one tell me about this? Why did we just get taught about pharmaceuticals when actually you look at the nutritional literature and you look at the plant-based sort of nutrients and chemicals and stuff that have such amazingly powerful and multimodal effects. Why is it that we've just been taught about that? So anyway, so then I found the Institute for Functional Medicine, along with a colleague who's GP in the UK, Sarah, and we just sort of like fell over it. Kind of we couldn't wait to get on the AFMCP course in London. And that was in 2015, so the year before I came to New Zealand. And so I sort of fully accredited with the IFM, and it was like coming home. It was like everything they presented at the AFMCP. I mean, they even showed papers that I'd read. And I was like, okay, this is it. I was reading the right stuff. I'd made the right conclusions. And their material, their educational material is literally mind-blowing. It's learning the real nitty-gritty of what actually affects the physiological processes in the body. So now I did a little bit of private practice with the functional medicine in the UK just before I left. But I waited till I got residency, and then I started up a little cabin office sort of clinic in my backyard. And then I moved into the premises that we're in now. So we do root cause medicine. My clinic's called Functional Again, and it's just opposite a funeral parlor. So I also often joke that I'm trying to sort of stave off people's visits to the stuff across the road, but haven't been succeeding in the last couple of years after everything that's happened. It's been really busy over there. But yeah, we do a fairly detailed in-depth process that allows us to really nail what the root causes are of people's sort of ill health, and we do some pretty amazing testing that most of it goes to the state. But the answers you can get from those tests are just so valuable. And then we build a protocol and a food plan and microbiome support and all of those things around each person. And we get really good results. So it's amazing what the body will do when you give it what it needs and you take away what it doesn't. You know, I say that if you get sick, there's only two reasons. Your body's either lacking in something that's needed for normal function. So, and that's usually a few things that you're lacking. So deficiency, and it doesn't have to be biochemical. It can be social. It can be, lack of love, lack of social interaction. So deficiency of the things that are necessary to be a human being. And then there's toxicity. So too much of something that shouldn't be there. And so what we do, and equally that can be toxic relationships as well. But what we do is we help people identify what those things are, give them tools to address them, and the body does the rest.
Amazing. Amazingly. I can totally imagine you would be so good at that.
I'm passionate about it, that's for sure. Not everyone, sort of, it's not a good fit for everybody. So it's, but we allow people to step onto the process with no commitments by having a 15-minute call with us so that they can at least hear our voice and understand how we might go about understanding what's going on for them, which is really, really lovely, because then, yeah, hopefully they get a sense that, oh, I mean, at the very least, I'd want our place to be a place where people feel safe. And that's what I've got on my website is safe, calm and heard is what I want people to feel. That's really important for me, that they feel like there's someone listening to them and actually understanding what's going on.
Especially after everything that's happened to you.
Yeah, no, it does. I have spent my whole life learning how to communicate. It's been something that's really been an important part of my self-development. I have really sort of studied that. And obviously with my work with the improvement work in the UK and the safety stuff, the human factors, you're constantly evaluating. Well, I am anyway. I'm always trying to get better at, listening to people. If you go into a communication with someone, or whatever that might look like, if you're going there sincerely with the intent to make that person's life better, then there's not you very rarely get stuck. And so that's really what, kind of, that's the nutshell what I've learned is that I always try and create a win-win. I bring, try and make the team work and try and understand before being understood. I'm using a few terms from various different sources here, but this is all sort of really very, very strong principles in terms of how to build trust with individuals, and that's what yes, that's what I've been doing for the last 20, 30 years, really.
Yeah, like I say, it sounds like a fantastic fit for you. Is there anything else that you wanted to talk about or say before we, I guess, wind up?
I understand that, so functional medicine can be prohibitive for some people in terms of the cost. So it's something that I think about a lot because, having worked as an employee in the health system, you never have to really consider what stuff costs. When you go into private practice, I'm not a provider for any of the insurance companies. I don't get paid by anybody. I don't do ACC work. My enterprise is purely self-funded. And so when I charge for our services, I think very carefully about how much I can do, what I can do there. And I'm not in it to make the money, I'm there I have to make some money, but I'm not there to rip people off. But I understand that it's expensive, especially if we do the testing. And so what I've done is I'm working very, very hard at the moment on a new gut health package, which will be much more affordable and is a multi-dimensional gut health package, which won't be like anything else anyone's ever done that I'm aware of anyway, certainly not that I've seen in New Zealand. It does mean that people have to be sort of close by. So I'm hoping that more people in the community can actually tap into that because it's less expensive than my detailed process. So yeah, that's I'm quite excited about that at the moment.
So how can people find you to do that then, Lee?
So they can go to our website, which is just functionalagain.com. So we've got a Facebook page as well. We also have like a sister website, functionalkids.co.nz. So I do work with children a lot. So, children who have behavioral problems, anxiety, ADHD, even, some of the more severe things like autism and stuff. We have a process that is, never ceases to amaze me what we can achieve. I'd like to say that I've got a Substack and all of that stuff in place yet. It's something that I've been trying to get to for ages, but at the moment I don't. I do have a book that is going to be coming out. I can't give you a title, unfortunately, or a time frame. But yeah, so that's another thing that's in the mix.
Oh, that's so cool, Lee. I feel like God is really using you for his own purposes and directing your energy in the best way. And I think it's wonderful actually what's happened for you, especially coming forward. Thank you so much for your honesty and being so open about what's happened, because I imagine it's hard to talk about. And yeah, thank you so much for your time, Lee.
You're very welcome. Yeah, it's been a lovely interview, and yeah, I'm very grateful and thankful for you as well and your work. I think you've done a marvelous job, and I sort of must try and model some of my stuff on what you've done, because I think you really strike a chord with people, and your sincerity really comes across. I really admire that.
If you enjoyed this video, please visit supportdrsam.com